Hello, my name is Makerere. I'm happy to introduce to you Centers for Her, a mobile application that links girls and women who experience violence to the various support services, including sexual reproductive health services.
With the Centers for Her app, girls and women can now access free, fast and confidential post-violence services. These include emergency shelter, police stations, legal aid, counseling, toll-free helplines, health facilities, and services like HIV and AIDS post-exposure prophylaxis, emergency family planning pills if reported within 72 hours, treatment of STDs and other injuries, among others. Centers for Her app can be downloaded from the Google Play Store. To access any of the services, for example, police stations, tap on the categories option, choose police, select a station closest to your location. This will be represented by a black pin. You will then get directions to the center. Centers for Her is an app that women, girls, community leaders, and service providers can all use to refer survivors of violence to different service points.
But people are free to come or call me on my number 0772 63 8466. That's also my WhatsApp number 0772 63 8466 or 0700 180 114. If you call those numbers or send me WhatsApp, we can arrange and meet. Issue is nobody should suffer alone. You can get support. I may not be able to help you because I don't know everything, but I can know somebody who knows somebody. Okay, because I know someone here works at Nakuru. I can send you to him, and if we can't help you, know somebody who works at IDI, we can work together and make sure that we do it.
We need to work as a team. And then also don't forget also to call those numbers. We are going to put those numbers down on our timeline and also on our social media, and those just can reach out to our team. Because it's just here to help everyone who needs information. And also don't forget to download the Centers for Her application that directs or gives you for information. You can access GBV information. You can also access where you can meet a doctor and talk about different things. Also centers where you can get different services. So Dr. Watiti, I want you to tell us more about pregnant mothers who are always tested and they're HIV positive, and they feel like life has ended for them, and they think they can't produce a baby who is HIV negative. What's the best information you can give to that mother or that woman out there?
Look, even if you are HIV positive, you can produce an HIV negative baby. I've already talked about the fact that even if you're HIV positive, you can actually get married or have a sexual relationship with an HIV negative person. Although people do what they call serosorting. Serosorting meaning people say, I'm sour, I don't want, I get for me somebody, link with somebody who is positive. We do that also. Part of we help colleagues who are positive to link to colleagues who are positive if things work out good and well. But if somebody is negative, you can still relate. And a positive woman can produce a negative baby. So that should not be the end of life. That I will never have babies. You can have children if you want. Of course, all those children you can look after. So long as your viral load is suppressed. When the child is born, they also put on ARVs for some time. And by the way, these days we encourage them to breastfeed. Because those days say no breastfeeding. That's not true. They should breastfeed their baby. And then they are taken care of. And most of the children are not negative. They are not positive.
And how best can somebody keep his viral load suppressed?
By taking their ARVs on time. ARVs, an example here. This is the old one. The new one is called tenofovir, lamivudine, and dolutegravir. This one is tenofovir, lamivudine, and efavirenz. Most people in the past had this one. There are 30 tablets. There are 30 days in a month, meaning you swallow them daily. But more importantly also, that you swallow them at the same time, by the clock, not by just evening. Say I'm going to swallow in the evening. So yes. Now when I've put on the clock and it says it's 8 p.m. and I say I'll swallow at 8 p.m., it means tomorrow I swallow at 8 p.m. because this medicine was formulated to last in the body about 24 hours. So every 24 hours, I swallow 1 tablet. At the end of the month, I've swallowed 30. If you do that, your viral load will be suppressed sustainably, undetectable sustainably, meaning that it doesn't crop up. So you can live a very normal life. For example, for me, I've never suffered from any serious illness since 2003, when I started taking my ARVs. Actually, 2004 there. Because before that, I was buying ARVs. From 2004, I started getting PEPFAR support, and I don't buy. So my only work is to make sure I swallow. But I also make sure I eat healthy.
I was coming there.
Yes. By eating healthy, meaning you avoid junk. There's a lot of junk these days. Young people, you find them there. Many of my patients are put on too much weight. See? A man like me is carrying 100 kilograms. That's too much. A man who looks pregnant. That's not good. Yeah. But of course, eat healthy, eat a lot of fruits, exercise. Exercise. There's another thing we talk about ARVs, what you call pharmacovigilance. Pharmacovigilance means be vigilant about side effects. There are some medicines which have long-term side effects. For example, one of these medicines, called tenofovir, affects bone health. So for older people who are on it, sometimes they develop bone pain. If that happens, you should seek counseling and they may have to remove it. I have a friend whose bones were broken, because she didn't get good care. So if you forget that, there are, for example, people who are on medicine like dolutegravir, it causes them to put on a lot of weight. Yeah, see somebody is putting on weight. One thing you can do is reduce on the food portions and also exercise. But if it is too much, you may have to have it removed, especially if your blood sugar becomes high. Because we have seen that some people, when they're on dolutegravir, it causes diabetes. Now that's called treatment literacy, knowing the medicine by name, not just by color and shapes.
Yeah, because I've seen very many clients at our clinic who come and say, so they look at, if they give them different
medicine is like human beings also. Today you are putting on this drug, tomorrow you are going to put on another one.
Something else.
Today you have hair, tomorrow you can come when you have cut your hair.
Yeah.
Before you came, I had a beard, but I shaved. So just people's appearance. So know the names, like the names of your friends, surely. Even if it's a very difficult name, you try to learn the name of a friend. These are your friends. ARVs are friends, people living with HIV. So say tenofovir, lamivudine, favirenz, or dolutegravir. The names are difficult because they are Bazungu names. If it was Uganda, maybe we would have Mururuza, Mukalakasa, but some of the Bazungu would be the ones struggling with the names. But now we have to learn them. Yeah. But even if you don't know how to pronounce them, know how to spell them, I even tell people that, during the lockdown, the medicine was changed. Why don't you take a picture of your medicine?
Put it in your phone.
Yes.
What if
So
somebody,
they ask you,
if somebody bumps onto your phone and sees that picture?
there are so many pictures in your phone. I don't put there, I just take a picture and leave it.
Because very many people. And also, I want to tell us about how we can easily keep our medicine safe. Because I've seen very many people, after giving them medicine, they open, then they remove and pour it in a conveyor. Because they things shake.
Yeah, but why do you call Boom with it? Inside here, I can't open because this one is not mine. This is for a friend I'm keeping. Inside there is another thing which keeps it. It's called a descant. If you remove it, so the only time you open it, for example, when you open this one, it is sealed. When you open the seal, sometimes you find cotton in it to keep it. Then there's something round or a piece of that look like a tea bag to protect it. It's called a descant. It absorbs. Well, so when you open, air enters and air has water. So it absorbs that. If you remove it and put it in another conveyor, I don't have that one. Some people remove this. They remove this so that you don't know. See? So whenever a patient brings that and they remove it, I know they have stigma. They don't want people to know. When the patient comes, you also look at the bottle, it is dirty.
That's very true.
So it means they don't wash their hands before they do what? They open. You find a charcoal, somebody has been peeling. So that helps you to teach the patient how to look after them. This is life. hold it properly. Don't put it in the bra, don't put it in the pocket, put it in the handbag. I didn't have my pill box here, but normally for me, I put in a pill box of 7 days, Monday to Sunday, so I pick and swallow. If you don't want to move with it, all of it, get a pill box. Get a pill box, and then you put in your bag like this. Don't put in the bra because it's not. Don't put in the pocket. They say it shakes.
Yeah, it shakes.
But why do you shake it?
Because I've seen very many after they give them almost like for 3 months.
Now we're even giving for 6 months. So get pill boxes. Get the pill box. When you get a pill box, it will help you keep your medicine for the week. I pack for the week. Keep the other one in the drawer like I've kept here. Don't remove the cover. Why do you say so that the people at home they think you are swallowing what? You are swallowing multivitamins.
Yeah.
That means this person has stigma. People at home should be happy that you are swallowing your medicine.
Talk about self-medication to people who are living with HIV, because we have seen very many of them who take ARVs and also accompanied with. Also, we'll talk about also this local medicine.
Local medicine,
yeah,
yes.
Local medicine. Very many of them are taking ARVs and also taking.
Well, I said this. I'm a doctor, but I don't treat myself. I have not treated myself. I don't prescribe for myself. I go, I see even a young doctor, a colleague, but they look after me. They prescribe, they check me. I know. I may even know better than them, but they are my doctors. Don't treat yourself, even if you are medical. These other medicines, of course, you may have to swallow medicine. For example, there are diabetic medicines, there are blood pressure medicine, but they should be prescribed. Because medicine have what they call interaction. This one is pushing, another one is pulling. So, if, for example, you're on this medicine, then they put you on treatment for TB, you should tell the doctor who is putting on that I'm on this one also. But try to avoid using these drugs like this budomola, because you don't know what is budomola. The truth is that there are so many concoctions, I don't want to mention names. You know some of them, the meningitis, sacha, vichi. Those medicines, we don't know what is in them. So I would personally strictly tell you, don't use this thing. But if you must use it, show your doctor. I'm using this. Can I use Mukama Nayamba when I'm on this one? So the doctor should be the one to find what is in Mukama Nayamba. Let's check. And actually, I hope the people check. Because they say there is this, but is that it? Because I should be able to check. There may be something else that may hurt me. Because medicine is, let me use this word, poison. We use it, however, because they charge of their life.
Sure.
Yeah, seek information, start with me. Government cannot come and, for example, tell me to solve my medicine. Government cannot come to tell me to abstain. Government cannot tell me to stop taking alcohol. It's me.
It's your life.
It's your life.
Yeah.
Take charge of it.
So Dr. Watiti, as we are winding up, so we are with Dr. Watiti. Watiti is the author of these two books, knowing his experience about HIV as a person living with HIV, and also 100 questions about HIV that people used to ask him. And today we are in his office, just located at Namgongo Road before reaching the bridge. He gave his phone numbers. We are going to put the phone numbers down there on the timeline. Remember, we're talking about HIV and also how best can young people or any person outside there live with HIV. When he or she knows that I have HIV, but that is not the end of life, and this does not stop me from doing anything that I want. So, Dr. Watiti, my last question would be, what will be your last information to anyone who is watching you right now and would like to get the direction to your office if anyone wants to access you?
Well, one, I've given you the numbers. I think that's the most important. Because of the current situation, I try to avoid going to crowded places. But also the traffic jam, I try setting up an office at home on Namgongo Road, Doctor's Lane. You can find me there. If I'm not there, call my number, we can make an appointment. But the most important thing is not necessarily Dr. Watiti. Actually, in every community, in every district, there's a person called an HIV focal person. There's a person called the district health officer. There are these systems, use them. Go get, for example, if I were to seek information in the district, I would look for the telephone number of the HIV focal person. There are about 108 1,840 ART centers, antiretroviral treatment centers in this country. All those people have focal persons. You can get this information from Ministry of Health, where is the nearest health center where ARVs are given. Normally those people who are there have knowledge. The same knowledge that I've given you. Get it. Get that knowledge. Knowledge is power. When you have knowledge, for example, you know your HIV status, it will empower you. If you are negative, to remain negative. If you are positive, it will empower you to stay, how to live positively, like I have done and many others are doing. Lastly, which I want to tell people is learn the facts about this disease. What causes it? How it is transmitted, and therefore how we can prevent it. And how do we help people who are already infected like me? How do you support me? If you know that, then the issue of stigma will not be a problem. Stigma is based on myths and misconceptions. Once you know the facts, these things will pale away. It's like darkness. Once you put on the light, the darkness disappears. I wish you well, and I pray that nothing bad happens to you, especially during this COVID-19 lockdown and the other measures. Follow the soaps of preventing COVID. Incidentally, they are similar to those of preventing HIV. Washing hands and avoiding certain things like we have done, we have told you, and we can get over this. Thank you.
So most of the things have been said. If you're outside there, you are any person who's going to move around, you avoid public places. You wash your hands every time that you visit the toilet or anything. Wash your hands. Sanitize. Use a mask every time that you don't go into like public places, and make sure that you take care of your self. Like COVID is real. Very many people have got COVID. Good enough it heals, not like HIV. And don't discriminate yourself. Don't discriminate on who's living with HIV. Like we need you. The way you want to live is the way also she wants to live. So take care of yourself, respect everyone. So thank you so much. There's been discussed. We have been having Dr. Watiti. It's just brought to you by the network and also Centers for Her and a mobile app that you can easily download and get information or get access to GPV service centers everywhere in Uganda where you need the services. Thank you so much. It's been discussed. See you next time.
Hello, my name is Makerere University. I'm happy to introduce to you Centers for Her, a mobile application that links girls and women who experience violence to the various support services, including sexual reproductive health services.
With the Centers for Her app, girls and women can now access free, fast and confidential post-violence services. These include emergency shelter, police stations, legal aid, counseling, toll-free helplines, health facilities, and services like HIV and AIDS post-exposure prophylaxis, emergency family planning pills if reported within 72 hours, treatment of STDs and other injuries, among others. Centers for Her app can be downloaded from the Google Play Store. To access any of the services, for example, police stations, tap on the categories option, choose police, select a station closest to your location. This will be represented by a black pin. You will then get directions to the center. Centers for Her is an app that women, girls, community leaders, and service providers can all use to refer survivors of violence to different service points.